Hello, it is Jade, and I kind of wanted to share all the stuff that I have found, so I decided to make this video. So, my question is, what if your sense of self wasn't continuous? What if parts of your identity could be could take control at different times, holding memories, emotions, and experiences that don't fully connect? Today, we are taking a deep and honest look at dissociative identity disorder, or DID. I just came back from a therapy session not too long ago, and I wanted to share what I've learned so far through my experience with mental health professionals. Um, this is a condition that's often misunderstood, misrepresented, and sometimes even dismissed entirely. But behind the confusion is something very real: a complex psychological response to trauma, and a very powerful example of how the human mind tries to survive through all of it. Um, but the first section that I have written out is section 1. What is DID really? So, dissociative identity disorder is in the name. It's a dissociative disorder, meaning it involves a disruption or disconnection in identity, memory, consciousness, and perception. At its core, DID is defined by the presence of two or more distinct identity states. These states are often referred to as alters, and they're not just moods or roles, they are distinct patterns of experiencing the world. And they may differ in the way a person speaks, their posture or body language. Hey, Mavis. Anyway, their emotional responses and their memories and knowledge. So, importantly, DID is not about having multiple personalities in a dramatic or fictional sense. It's about a fragmented state of identity where different parts of the self are not fully integrated. So, in understanding DID, you first have to understand dissociation. Dissociation is something everyone experiences at times. For example, zoning out while driving, like highway hypnosis or whatever, getting lost in a book or a movie where you're zoned in, or you're like locked in and the world around you just disappears. There's also not remembering part of a routine task, like walking into a room and then forgetting why you're even there. These are mild forms, but dissociation exists on a spectrum. At the extreme end, it can involve feeling detached from your body, which I deal with a lot. There's losing time, where the amnesia sets in, which I have a lot of, and experiencing identity fragmentation. In DID, dissociation becomes chronic and structural. It's not just occasional, it's a fundamental way the mind is organized. And then how DID develops. The role of trauma. DID is not, it, or DID is strongly associated with early, repeated trauma, often in childhood. Well, exclusively in childhood. This may include abuse, neglect, or like chronic fear or instability. Um, During early childhood, the brain is still developing a unified sense of self. Under normal conditions, different aspects of personality gradually integrate into one identity. But when trauma is overwhelming and repeated or ongoing, the brain may not be able to process everything as one experience. Instead, it separates different parts of the mind take on different roles, such as holding traumatic memories, managing daily life, protecting the individual emotionally. This process allows the child to continue functioning even in unsafe environments. So, DID is not random, it's an adaptation or a survival mechanism. And then the structure of identity in DID. In people without DID, identity is relatively unified. You may feel different in different situations, but you still experience yourself as one continuous person. In DID, identity is divided into parts that are more separate and less connected. These parts may have different memories, hold different emotions, and basically just experience the world differently. Some researchers describe this as a failure of integration rather than the creation of entirely separate personalities. So instead of thinking of DID as many people in one body, it's more accurate to think of it as like one person whose identity is divided into distinct, less connected parts. So what are alters? Alters is a commonly used term for identity states in DID. Each alter can have its own name or identity, age or perceived age, gender identity, emotional role, like the list goes on. But for example, a protector alter may emerge in stressful situations. A child alter may hold early memories, whereas another part may handle daily responsibilities. Not all alters are dramatically different. Some differences are subtle, and not everyone with DID uses the term alters. Language varies in many, many different ways. So now on to the memory gaps and amnesia. One of the defining features of DID is dissociative amnesia. This means a person may not remember things that happened while another identity state was active. Examples would be like losing hours or days of time, not remembering the conversation that you just had, finding objects that you don't really recall obtaining, and then being told that you acted extremely differently from how you usually do. This can be extremely confusing and distressing. It can also make daily life extremely difficult to manage. So, Switching refers to a change from one identity state to another. This can happen suddenly, gradually, or in response to triggers. Triggers may include stress, reminders of past trauma, or like emotional situations. Switching isn't always obvious to others. Sometimes it's subtle, like a shift in tone or behavior. Other times it can be more noticeable. And then what I really wanted to talk about is DID versus media portrayals. So, like, often media portrays DID in extreme and inaccurate ways. Examples would obviously include movies like Split, which dramatize the condition for entertainment, which I absolutely hated that movie. I love James McAvoy, but I hated that movie. Like, it was not accurate at all. Maybe a few of the mannerisms, but no. Common inaccuracies would definitely include instant dramatic transformations, violent or dangerous behavior, or clearly defined exaggerated personalities. Whereas people in reality, most people with DID are not violent. They're more likely to be re victimized. Switching is often subtle, and the experience is usually confusing and not theatrical. So, all of those portrayals create stigma and misunderstanding. So, DID is officially recognized in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, which is the fifth edition. Diagnosis typically involves clinical interviews, assessment of symptoms, and ruling out other conditions because it's usually misdiagnosed as something else. Like when in the beginning of my mental health journey, when I was like young, like 11 or 12, I was diagnosed with bipolar, borderline, schizophrenia, like, and none of them stuck because none of them were accurate. Um, so it's important to note that DID can be especially difficult to diagnose because symptoms may overlap with other disorders, like being comorbid with other disorders. It's kind of common for people to have, say, borderline and DID. So it just depends on the person, I guess. There's also an ongoing discussion in the scientific community about how DID develops, how common it is, the best ways to treat it, but the condition itself is widely acknowledged in modern psychology. Nowadays, anyway. Like, that's good. And then, what DID feels like internally, that one's hard to explain. People with DID often describe experiences such as feeling like different parts of themselves take turns being in control. There's internal conversations or conflicting thoughts. There's a sense of disconnection from identity in general. Like, you may feel like you are someone else, or you don't feel like a person at all. There's also a feeling like a stranger in your own actions, if that makes sense. You may feel fragmented, confused, and very overwhelmed, honestly. But others may not fully realize what's happening until later in life. But yeah, from what I've been told, I have pretty severe switches. Not as severe as it could be, thank the gods, but it's it's still really prevalent and hard to traverse through daily life, if that makes sense. Um, Treatment and recovery. So, treatment for DID is typically long term and trauma focused. It often includes psychotherapy, which is talk therapy, learning grounding techniques, which I'm pretty sure Aurora covered that a little bit. Building communication between identity states, as well as processing traumatic trauma safely. So there's no risk of self harm, suicide ideation, whatever. The goal is not always to eliminate identity states. Instead, treatment focuses on increasing stability, reducing distress, and improving daily functioning. But in some cases, identity states may become more integrated over time. This is so meta. I love learning about this. It makes me feel like I'm finally understanding why I'm so messed up in the head. Misconceptions and harm. Misunderstanding DID can cause genuine, severe harm. I should know. Misconceptions commonly include it's fake or exaggerated, it's the same as schizophrenia, or people with DID are dangerous. These beliefs can prevent people from seeking help that they desperately need. It can lead to misdiagnoses or just increased stigma. Like, I was bullied for most of my life. That's why I graduated from high school a year early, so I could just get out. But accurate education definitely matters, and that's why I'm trying to learn as much as I safely can. If it's triggering, then I'll come back to it later, or I'll bring it up with my therapist so we can go through it together. But yeah, this is all the stuff that me and my psychiatrist have been learning together. When discussing DID, respectful language is extremely important. So instead of saying split personality, you can use dissociative identity disorder or a person with DID. Or if you're old fashioned, you can call it multiple personality disorder or MPD. It focuses on the person's experience more so than the condition. It's the role of trauma and the reality of the condition. And so, why this matters is because DID challenges how we think about identity, memory, and basically overall consciousness. It shows that the mind is not always a single unified system. Instead, it can adapt in complex ways, especially under extreme conditions. Understanding DID isn't just about one condition, it's about understanding trauma and resilience and basically the flexibility of the human mind. And then, yeah, so my outro will be this. Dissociative identity disorder is not about entertainment. It's not. It's not about dramatic personalities or shocking plot twists. it's about survival. It's about protecting your soul from corruption. It's about what happens when the mind does everything it can to protect itself. And when we take the time to understand it properly, we can replace fear and confusion with something exponentially better: clarity, compassion, respect. So, if you found this helpful, consider sharing it, because accurate information can make a whole lot more difference in the world. So, take what I said to heart if you can. If you learned anything, let me know what. If you have more information, let me know. Thanks for watching.